To collect a sputum specimen, first provide privacy and identify the patient. Position him in a semi-Fowler's position. Then assess the patient's respiratory status and anxiety level. Plan to continue assessing these factors during the procedure. To collect a specimen by coughing and expectoration, put on clean gloves and give the specimen container to the patient. Caution him not to touch the inside of it. Then have the patient take 3 or 4 slow, deep breaths. Tell him to exhale slowly and completely to move pulmonary secretions into the larger airways. Make sure you are positioned to the side of the patient to avoid inadvertent aerosolization of sputum when the patient coughs. You may choose to wear a mask for added protection. When he completes these deep breaths, ask him to cough after the next full inhalation. If the patient can cough productively, have him expectorate the sputum into the specimen container. Do not let him clear his throat and spit saliva into it. Repeat the sequence of deep breathing and coughing until you obtain 2 to 10 milliliters of sputum, not saliva. To collect a specimen by suctioning, prepare the suction machine or device, ensuring that it's functioning properly. Then connect the suction tube to the adapter on the sputum trap. Pour a small amount of sterile saline into a sterile container. This saline will be used to rinse the suction catheter or push the sputum in the catheter into the sputum trap when the specimen obtained is a small amount. Then put on sterile gloves, keeping your dominant hand sterile for the procedure and your non-dominant hand clean. Connect the sterile suction catheter to the sputum trap. Remember to keep the trap upright to avoid inadvertent suctioning of the specimen out of the trap. If appropriate, pre-oxygenate the patient for 1 minute with 100% oxygen. Then lubricate the end of the suction catheter with sterile water. Without applying suction, gently insert the lubricated catheter tip through the patient's nasopharynx or endotracheal tube or tracheostomy, and advance it into the trachea. As the patient coughs, apply suction for 5 to 10 seconds, collecting 2 to 10 milliliters of sputum. Then release the suction, remove the catheter. If sputum remains inside the suction catheter, suction a very small amount of sterile saline to flush the specimen from the catheter into the trap. Now detach the catheter from the sputum trap and turn off the suction. With either collection method, tightly close the specimen container. For a sputum trap, connect its rubber tubing to the plastic adapter and dispose of the catheter properly. Now note the sputum characteristics, including color, consistency, odor, volume, viscosity, and the presence of blood. Offer the patient tissues and dispose of them properly. If any sputum is present on the outside of the container, wash it off with disinfectant. To finish preparing the specimen, securely attach the properly completed identification label to the side of the container. Place the specimen container in a biohazard bag and seal it. Then remove your gloves and place the first bag with the specimen into a second biohazard bag with the completed laboratory requisition. Make sure the specimen is transported to the lab or refrigerated immediately. As part of your follow-up care, offer the patient oral hygiene and plan to review the sputum test results when they are ready.